in Singapore, US.
That's very
Yeah.
nice.
Okay, ladies, we are live.
Okay, that's wonderful. So, hello everyone. My name is Ankita. We have a very good person today with us, Dr. Pranjali Nehete. She is a MD homeopath, and she is going to tell us about the health of women, how to take care of it, and so on. Today we will discuss all these things, and it is powered by inspiring Indian women. And all over to all over to Pranjali ji. Hello, Pranjali.
Hi, Ankita.
Uh, Pranjali,
How
how
are
are you
you?
doing? I am
Yeah,
wonderful.
I'm doing well. Thank you. So thank you for having me here. Thanks to Inspiring Indian Woman. Thanks to you also for a wonderful hosting. So yeah, so shall we start, Ankita?
Oh yes. So I just want to know more about you. Firstly, as I we have a conversation on a call. So can you tell me like from where you started and how you got this inspiration? I have heard that you are a part of Asha Homeo Care. You are the founder of it. You are practicing in US, USA, UK, and Singapore, and in India also. So, who is your inspiration, firstly? I want to know that.
Yeah, actually, my inspirations is all you are like all the inspiring women who struggles in their daily life to achieve their goals. So yes, I have been practicing in USA, Singapore. Still, I have many clients in US also because I have a non-medical husband. So we move around the globe. So that's
Oh,
why because of his work profile, we are moving means we relocated at many places. So now we are in UK and I have started my practice years before the 2.5 years. But uh, I don't feel like it's very new to me because it's already like I feel like I'm here since more than the 15-20 years. The
oh,
love and everything is like it's like amazing, like all the supports and all the love from my clients. I'm so so grateful to everyone.
that's really
Yeah,
nice.
so you
And
can
we are
see my
very
screen.
proud of you.
Yeah, thank you so
Yeah,
much.
we can see that.
Yeah, okay, one minute.
So
Yeah.
today, it's all about the human health, the women health nowadays. So yes, I'm very excited to know more about it, to more about myself actually. So yes, can we start, please?
Yes, so yes, we start first little bit general introduction with the homeopathy. Then we'll discuss a little bit about the clinical conditions which are more suffering in their daily life in female disorders. Okay,
Okay,
so we start with the general introduction of homeopathy first. So as I mentioned, like I have practicing in many countries. So I have a experience as an international practitioner, and I have successful handled cases in India, Singapore, USA, and now in the UK. I have successfully treated the clients suffering with the acute chronic issues, skin diseases like eczema, psoriasis, allergies, recurrent infections, emotional and the mental disorders, gastric issues, urinary issues, female disorders, hormonal issues. Because the UK is very favorable for the allergies. UK's climate is very favorable. So I have many clients, they have a recurrent respiratory issues and recurrent infections history, the skin complaints like eczema, food allergies, nut allergies.
oh,
So yeah, so it's very homeopathy is very good in the recurrent issues.
okay.
So we will go
So I
to the
heard that. homeopathic take time, but yes, it works from the root. It will
Yes,
the
but it depends,
causes.
Ankita. Like some misconceptions also in the like community, because when the homeopathy takes time, when the complaints or the sufferings you are suffering from a longer time, because
Okay,
we need to find out the root cause.
correct.
But in the acutes, you can get the definitely the result like the modern medication. We are also practicing in the acute conditions also.
Okay, correct.
So,
So
yeah,
I have a question, like, is apart from India, I thought on your on homeopathic work only in India. So how people are adapting that? Are they know about it or what?
actually, India, yeah, in India, there is a different way of practice, and in the Western countries, there is a very different culture and a different way of practice. They have their proper certification. We need to ensure ourselves to practice very safely, and world is moving towards the holistic way more other than the modern medications. So
Correct.
definitely people wants to go with the side effect free medicines and the remedies. So
Wonderful.
definitely people are like getting the more response from the people to the homeopathy, because it's a holistic, it's a safest medicine in the world. So it doesn't have any side effects, and anybody can take the medicines, like the from the pregnant woman can, infant can, old aged, like at the age of the 90 also you can take the homeopathic remedies
Okay,
for your
that's really
acute
nice.
and the chronic complaints.
Okay, that's so nice of you. Thank
Yeah.
you.
So, yeah. So, this is a little bit about the introduction about the homeopathy. Like homeopathy is the alternative medicine which is based on the holistic treatment, and the treatment based on the extremely diluted substances. In homeopathy, we have a one principle, like cures like. We call it as symptom similarity concept. We used to treat various conditions, like I already mentioned about the all the recurrent infection, allergies, gastric issue, female disorders. And in female, mostly the ladies are suffering more because of their stress and the daily routine schedule.
Don't ask
So the
me.
yeah, so the hypothyroidism, PCOD is very common in young girls because of their lifestyle changes and the stress because of their studies and competition, and the skin issues like the eczema, psoriasis, food allergies, the cosmetic allergies. And other thing is related to the piles fissure. It's a dietary related disorders. And the most common here I notice like autoimmune diseases. The people are more suffers with the autoimmune diseases like SLE, psoriasis, psoriatic arthritis. And yeah, and the another thing I notice in the US and the UK, the emotional issues with the depression, because Singapore living is quite means the living has their Asian touch, because it's very near to India, and the
Okay.
Asia's culture is quite different. But the Western
Okay.
culture is different. Their living is different. Their eating habits, their lifestyle, everything is very different. And because most of the time the people more suffer with the anxiety issues and the depression in the period of the winter season, because day and night the darkness is more that time. And the ladies, because they are not going out frequently, so they feel like anxiety when the getting the dark outside. So
Oh,
yes, so emotional issues with depressions which flare up in the peak winter season here. And the pediatric disorder, so it's a means uh, I have got very good result in pediatric disorder, and very good response from the community in pediatric cases, because here the kids are more suffering. There is
Okay.
no way, and because of the long wait in the modern medication treatment, so people are more seeking towards the help and the
Oh,
holistic help, because kids are more suffering because of the recurrent cold infection, because of the weather changes, like now the spring season is here. So most of the people and the kids are suffering due to the pollens and the grass allergies like the hay fever. So we can treat that all the allergies, all the clinical condition with the homeopathy, considering their root causes. Okay,
that's
so
all right.
most of the time, people ask me about like, is it safe in kids or infant or in the pregnancy? Yes, homeopathy is safe in pregnant women also, in pediatric also, in small babies also, like the day one baby can have it, and old aged person also can have it, because it's best applied during the childhood and safe during the pregnancy, and works very effectively in the children, because when you are at the young age your susceptibility is more. You will get the medicine, it will automatically boost your immunity, so it acts more strongly and more actively in the children. So
Okay, nice.
it helps to build the immunity levels in children, because of their high susceptibility it acts very fast, so it
Okay.
boosts the immunity in the kids to prevent their frequent sufferings.
Okay. Thank you for
Yeah,
this information.
yeah. So next is the how it works and what to expect. Like the in homeopathy, we work as a like it's a holistic treatment. So we treat patient as a whole, not only the one symptom, considering their root cause. When the conditions or the complaints or the long suffering, that time we need to take the proper detail case taking, like how to ask everything, all the things like they are related to the present history, all the modalities, all the associated complaints, and everything. So after that we find the root cause and we start our line of treatment. Yeah, and it acts on the mind in the holistic way. During our case taking, the mind is very important, because sometimes in the depression or the emotional causes, the mind plays very important role. Subconscious mind stress, subconscious mind disappointment, that or and constant grief, sometimes it causes the more outbreak, and that suppression causes the other clinical conditions, so we need to consider that root cause first. Yeah, and how to take the medicine, like people are saying like, yes, that the small one, like white pills, is it sugary, is it safe for the diabetic patient? Yes.
That is my
Is
question in my childhood that I just love this medicine because of this.
the sweetness.
Yes, the sweetness. I don't like that. I don't want to go to the doctor who give me injection. I want a sweet doctor.
Yeah, yeah. The sweet, actually, that sweet pills are the magical pills. The small dose have the power to cure or the reduce the intensity of symptom which are you are suffering from a longer time. So yes, it's a magical remedies. So in daily doses, we give generally 3 to 4 globules, like according to their intensity of symptoms. Sometimes I will give you the liquid potencies also. Sometimes it's a mother tincture. It's a way of taking, and the only you need to careful about the your oral hygiene. When you are taking the medicine, just take a 15 to 30 minutes gap before medicine and the after medicine, to prevent or to mean sometimes the smell, the strong smell nullifies the action of remedies, so we need to prevent that antidotes. Okay, that's the administration tips. And the other thing, what to expect, the sharing, the sharing patients' emotional and historical background, key events in addition to his or her current health condition, essential to identify root cause, regular follow-up at the 2 to 3 interval, no immediate relief like other medicine, That's the things like I already explained, like the we need to take the proper detail case taking in the long term suffering. But in the acutes also, sometimes the when the people are having some symptoms or the some complaints because of some indisposition, like some people are having loose motion because of the food poisoning. So in that case also we can take the homeopathy. Sorry, Ankita, I can't hear your voice. I think you are mute. Yes? Yes, Ankita.
Hello.
Yes?
Oh, nothing. Is it?
Yeah.
There's
Okay.
I think.
Okay. So yeah, in acutes also, like in the food poisoning, we can take the help of the acute remedies like the some arsenic or the aloes, like which can prevent and which reduces your intensity of the loose motion and the stomach infections. So, because the homeopathy acts very well in acute conditions also, so I'm giving my patients to some acute remedies and some emergency medications during our proper chronic treatment. Because in the asthma patient, like for example, in the asthma patient, they are having the breathlessness issue or the asthmatic attacks because of the weather change, because of the damp weather, because of the rainy weather, they are having the episodes. So that time, if you take one dose or you repeat the emergency medicine dose frequently, it will definitely reduce your asthmatic attacks. So I generally give with the chronic treatment the emergency medicines, like depend on their symptom intensity. Okay. So yes, and most of the time the people are frequently asking like how much time it will take, Pranjali? How much time it will take, Pranjali? Yeah, because there is some misconceptions also. Like every homeopath has their different skills to practice, because there it's all depends on their skills and way of thinking. So, when the people have the multiple pathology or the multiple clinical conditions are involved, and if they are suffering from a longer time, it will definitely take time,
Okay.
because it's all depend on your immunity, all
Exactly.
depend on your susceptibility, all depend on your resistance power. And you are suffering from a longer time means your immunity definitely weak. So we need to boost that immunity, we need to find out the root cause. So it will take definitely time, but your faith, your regularity, your consistency, you will see definitely result within the 3 to 6 months in chronic cases. Okay. So
So this is
next,
amazing. This is
yeah.
like a magic.
Yes. So the another question, like people are asking frequently, is it safe to take? Yes, globally accepted that homeopathy has no or the minimal side effects, because it's depend on the holistic concept. It's made of the pure natural substances. The natural substances, the means the raw substances, potentize it and prepare the medicines. Means we have a many remedies, all the magical remedies, like we prepared from the salt also, venom also, everything. Like even nowadays we use the some organ remedies, like for the ovary diseases, ovary remedies, like they only act on the ovary complaints. The eye related, like iris remedies, so it all act on the only eye complaints. Kidney remedies, like it's all act on the kidney diseases. So yes, homeopathy is very safe, doesn't have any side effect, anybody can take the homeopathy. And NHS research also confirms the same. Homeopathic remedies are generally safe, and the risk of a serious adverse side effect arising from taking these remedies is thought to be very small. It is supportive type of remedies, and I always say to my patient, like, do not stop your regular medication without asking to your consultant or your specialist, because in western countries we have limitations to practice the alternative medicine. So we do not say, tell to patient, please stop the your regular medication and take only homeopathy. No, because homeopathy is a supportive type of medicine. It's a very different pathy. Modern medication is completely different. So, and it, you can take homeopathy with your regular medications with the
Oh,
modern treatment. So it's very safe to take the with the allopathy.
very nice.
Okay.
I mean, I was not aware about this thing because I think
Yeah,
I have to take the medicine at one time for one doctor only. A lot. So,
yeah. Actually, in India, the homeopaths say like because in India, the rules and regulations are very different. Okay, so the homeopath always say like yes, you have to stop this one and take only this medication, or you cannot take with the antibiotics. But in Western countries, you have very limited means you have a very limitations to practice, and the rules and regulations are quite different than the Asian countries. So we need to practice very safely during our career. So we do not say anything to stop this one, start this one, because we only follow our path like a homeopathy. So it's a supportive type of medicine. It's a holistic medicine. It doesn't have any side effect. It's a safest medicine. You can take with the modern medications. You can take for all your complaints. In some cases, like we have some limitations, like in the last stage cancer, or the people are suffering more than the 20 to 30 years. So in that clinical conditions, we have a limitation to treat. We do not say like we can cure that case, but we can control that case. In we can control their complication, we can control their future complication, future side effects in that clinical conditions we call as a palliative treatment. Okay, so Ankita, this is the general introduction of the homeopathy, like the basic things, like we find the root cause, we treat the patient as a whole. It's a completely holistic medicine based on the diluted substances. Okay, it's safe during the pregnancy, in the pediatric age group, in the old age also. Okay, anybody can take, even the in the cancer patient, the when the chemotherapy is going, you can take the homeopathy to reduce the complications, because during the chemo people are suffering more, their pain and their, because not that pain, but because of that mental situation they are more suffering. So
okay.
to keep the calmness and your mind stable, you can use definitely the homeopathy.
That's so
Yeah.
amazing. So
Yeah.
thank you so very much for all the information. I was not aware much about it. I just love the small sugary that medicine. I really love that. And I was not at all aware. So thank you for this awareness. So I have a
Thank
lot of questions. I am like a very bad student if someone is
Mm,
teaching. So if you
mm,
allow me, can I proceed?
yes, please. Yes, you can.
So firstly, I want to know how are you? I mean, I heard that you got met and I by an accident, right? Recently.
Yeah. I just fell down from the staircase in my home, so my shoulder joint here is little bit fracture, but I'm managing.
Oh,
Yeah.
please take care of yourself.
Yeah,
So
thank you so.
you're welcome, ma'am. So Pranjali, I just want to know more about, like, I have gone through a lot of people nowadays in India. I'm not sure about other. My in-laws, my mom, my dad is suffering for not having a sleep. I don't know why they are. I mean, everything is good, but yes, they they don't want to sleep at night. They are sleeping in afternoon or in the morning. And I have gone through very a number of relatives who are having the same issue in India. So what do you say about the such things, and what we can do to to fix it?
Yeah, the two things are we can say here. The first thing is lifestyle changes. Like everybody has their different lifestyle. Even in the India also, people are more like to wake up in the night and they sleep in the daytime. Because of that schedule affects sometimes in your night sleep or other thing like the second thing is your subconscious mind anxiety or subconscious mind tension stress because
Correct.
you're if you are thinking continuously about anything that time also causes your sleep insomnia. Yeah,
Okay.
the two things are very considerable here. So if you do any changes in your lifestyle, like wake up at the proper time in the morning and do your active daily activities in the daytime and take a dinner before the 6 o'clock and sleep around the try to sleep at the 9 o'clock or the 9:30, definitely you will be healthy and your life is also more becomes very healthy and happy because
Okay.
night mostly the nights are for the sleeping sleepiness, no?
Correct.
So yeah, so make us some lifestyle changes and if you are the cause is because of your subconscious mind to get the help of the alternative medicine or the yogas and the meditations or do some exercises to relieve or to reduce your stress and anxiety.
Okay. Perfect.
Yeah, yeah,
Definitely tell them about this.
yeah.
And what about the issue, like many people in my age group, if I'm going through, I have a lot of people who got just married and they are trying for a baby, but everyone have some issues. They are taking medicine for 1 or 2 years. Even I am taking a medicine, like I got married 5 years ago, and still I'm not able to conceive, and I have a lot of medicines going on, like with vitamin D, C. I think B12 is also going on, and some of the medicines is going on for me. So, is there any remedy, or is there any, you know, I can have homeopathic help me in this situation?
Yes, definitely. In infertility cases, we have a very good remedies which acts on the ovulation, which acts on the female reproductive system. The main thing I have noticed this 5 to 10 years, last 5 to 10 years, the ladies or men, like they are having more stress related to their work.
Oh yeah.
People are struggling like to achieve their goals. The lifestyle changes are completely different. Before the 10 years, you can if you see the ratios, like before the 10 years, ladies or the people can conceive easily, but
Correct.
last 10 years and during this peak COVID period, after that COVID period, many things are changed. So people
Oh,
are more struggling to towards their success and their career issues and some people are career oriented. So it's all related to your mind. If you stay positive, if you think positive, it automatically your hormones will secrete normally.
okay. Correct.
So if you change your lifestyle changes, if you take the help of the holistic medicine in homeopathy, we can treat the infertility cases also, but the probability is 50-50% because it's a very sensitive matter. So we
Okay.
cannot say anything like we cannot give the guarantee because it's a very sensitive things, no? Everybody
Correct.
has their sensitiveness. So yes, homeopathy can definitely helps in the ovulation and the reproduction and everything. But first you have to do and you have to start from yourself first. You have
Oh,
to do yogas, meditations to stay positive.
wow,
Think
wow.
positive. Definitely, you will conceive, you will get the result. So, simultaneously, with the help of the supportive medicine, do the some asanas, yogas, and some meditations that balance
Correct.
your hormonal levels.
Wonderful. We will practice that also.
Yeah,
And one, like I think it is a nationwide issue which is going on, that people are saying that, oh, I got a stress, I am in a depression, my I just got a breakup, I got failed. There are a lot of people who got suicide recently. There are a lot of we are nothing in front of them. They have a lot of they are amazing in their career, but still they got suicide. They gone with a suicide. They choose suicide. So what you tell the today's generation, especially, who is not achieving a good marks and they are going in a wrong way? I live in Mumbai, and you don't believe it, I have in my office, I'm working in Accenture, and in my office there are two type of people: Gen X and the people who are married, who are enough mature. And the Gen X
yeah,
people are like, they are just going for a smoke. And in my office it is like a non-smoke zone. So out of 20 people, 15 people got resigned just because we don't have a smoke zone. So what do you say about all these things nowadays going on?
yeah. That's why everybody is just promoting the mental health because today's main concern is the mental health
Correct.
because and the after COVID, you notice the many things are changed completely. Like
Oh my God.
people, they're living, they're eating, they're earning. Everything completely changed after the COVID, and mostly after the COVID, mental is more affected
Oh yeah,
because
after
of the
watching them.
economy. Yeah, in the young kids, mental health is affected because they used to more towards their digital media and digital things because for that 2 years the people are at home, everybody is using the phones, ipad, the laptops, and the social media, youtube. And both when the both parents are working and the kids at the home, uh, parents can prefer to give the phone, yeah, you can play the game. It increases their habits, no, and it reduces their concentration, so it means it's automatically affected their mental health. So somewhere the COVID or our routine is also responsible. Somewhere in that situation, at the very young age, parents have to do the conversation with the kids, like how to balance their everything, and just try to avoid to get the bad habits to their kids, to avoid their pressures and everything. And in young age like you, the people are more towards the smokings, alcohol
I'm
drinking.
very scared after watching these Gen X people, and it is really scary. Yeah, if you are at a 30 plus, you are like, you can't gel with them, right? So it is very scary.
Yeah, and that's why because of at the very young age the heart attacks and the death rate is more increased because they are using to bad habits, they are smoking, they are drinking, because the struggle and the means struggle for their success to maintain their career, to balance their family life and the career life, everything is causing the stress here, like your subconscious mind is affected. In homeopathy we say all things are related to your mind. If your mind is healthy, definitely you think positive and you are healthy. So
all I
yes,
can.
if you stay positive, if you think positive, if you do the good connections, good friendship, and good vibes, you are like becoming a successful person.
That's so nice of you.
Yeah.
So nice to hear. And it's all about, I mean, I have this much question only. And is anyone have any questions from audience?
I just wanted to know, like, how much homeopathy is popular in UK.
Yeah, that's the frequently question people are asking me when I have started my practice here. Like, do you certified? Do you have a license? Or is it like British people are taking the medicine from you? I means in here, like because of the limitations of the NHS services and their long wait for the appointments, people are more moving towards the holistic way. So yes, in the in the UK, homeopathy have more scope because homeopathy born in the Europe, and even royals are using the homeopathy. Till 2017, I think I remember 2017, NHS had also the homeopathy section. Homeopathy is homeopathy was in the NHS, but there are some rules and the regulations. They just I think they just separate the homeopathy from the 2017 as the integrated medicine. But in UK, homeopathy has so much scope. People are using, people are taking the benefits of the holistic healing. And because only in the alternative medicine have option to break down that tendencies which are having your recurrent infections, recurrent skin infections, nut allergies, food allergies. So yes, people are taking the homeopathy.
Thank you so much, Pranjali, for all the insight regarding
uh,
homeopathy. And
you're welcome,
we are
Rashmi.
indeed very thankful to you. Ankita, I think we are done with what Pranjali has noted and about homeopathy and the way it heals overall. So,
Oh,
thank you once again, Ankita and Pranjali Nehete,
Thank you
MD
so
Dr.
much,
Pranjali,
Rashmi ji.
for
thank
being
you so
part of
much.
this inspiring Indian women. We see you again next time, hopefully. And we will be meeting Ankita again tomorrow, same time,
Oh,
PM. And today also we have another session at 8:30. So if anybody is watching, do join us again. Thank you very much. Goodbye.
thank
Thank
you so
you.
much, Rashmi ji.
Thank you, ma'am.
Rashmi
Bye.
ji. Bye-bye.